If you're applying to medical school, chances are you're going to have to write a secondary essay, possibly several secondary essays. So today I wanted to give you a secondary essay prompt and give you some thoughts and ideas on how you might want to formulate your response. First, hi, my name is Dr. Sarah Klebe, and I'm an admissions expert at BeMo. So the secondary prompt that I have for you today is this. In which direction would you like to see healthcare progress over the next decade? So an interesting prompt, one that is going to have responses that are really hyper individualized based on your own knowledge and priorities as an aspiring future healthcare practitioner. First, I want to talk a little bit about what they are potentially looking for in a prompt like this. So they know that you're a student, that you're not a physician yet, not even a med student yet, so they know that you're not going to be fully aware of all of the current medical research going on and where that research is likely to head in the next 10 years. That's okay. You don't have to know all of that. You don't have to know everything, at least not yet. But they do want to see that you are dedicated and devoted enough to the practice of medicine as an aspiring future practitioner to at least start familiarizing yourself with the current status quo in medicine and some of the things that are kind of on the next horizon. So this in part is about demonstrating your own commitment as a candidate, that you haven't just sort of said, I'll learn about all that later. No, that you're taking initiative, that you're looking into what the norms are right now, at least, where things are kind of currently heading, and enough imagination to think about where you'd like to see that progress in the future. Now, in terms of the content of a response, there are a number of different directions that a response to a prompt like this could take. The two that sort of come immediately to my mind as I review it are sort of technological progress and social progress. So on the one hand, looking into medical technologies, medical research, where things are right now and where things look like they might be going is obviously beneficial as someone who's trying to get into medical school. You want to know what the sort of standards are right now, and you want to know where medicine is likely to end up or where it's sort of heading towards around the time that you'll be finishing up your schooling, your residency, and embarking on your own practice. So one thing I think that comes immediately to mind for me is the push towards individualized medicine, where there's a lot of research going on right now into medicine at sort of the genetic level, the level of DNA, and looking at how illness, ailment, disease conditions, all of that can be addressed at that hyper individualized level. So beyond the mere model that we have, that's the sort of the current status quo of treating whatever manifests through medication, surgery, etc., but looking at how that can be repaired again at that genetic level, and even looking into how those things might be able to be prevented through that kind of hyper individualized care. That's just one example of medical technologies and some of the things that people are thinking about, but it's an important one. And so if that's something that really excites you, thinking about these kinds of technological developments, that's something that you could look into in thinking about your own response to this question. Then on the other side, the social sort of perspective of a question like this, it's asking what direction we want to see healthcare progress. So it's not specifying the literal practice of medicine. So we could also think about the progress of healthcare in terms of addressing gaps and barriers to care that are experienced by some individuals and populations. So we know, obviously, that there are underserved communities and populations. We know that there are, groups that haven't been attended to in the same ways by the medical establishment. We know that there are particular communities of concern. Rural communities in particular have a lot of barriers and gaps in their access to care. Indigenous communities can have barriers and gaps. Various minority communities and other communities like that are often underserved. And so thinking about how healthcare isn't just the practice of medicine, but the act of advocacy on behalf of patients is a way of thinking through a particular answer to this question. If you're also someone who is maybe committed to universalized healthcare and you're living somewhere where there isn't currently universal healthcare, you could certainly talk about that. That's another social angle on this particular kind of question. Wanting to see healthcare progress in the direction of being genuinely accessible to everyone would be something that would allow you to demonstrate some of your own values and priorities if that's a perspective that you have. So those are just two ways that you could approach a question like this. This is a question where you can really use your imagination, but also, again, highlight your own commitment and dedication to the practice of medicine by demonstrating that you are already a keen observer of at least some of the foundations and trends in medicine today. So I hope that you enjoyed this video and that it was helpful. If so, please do go ahead, like it, share it with a friend who might benefit from it. Be sure to follow us on whatever social media platform you're on right now. If you'd like us to help you, click the link that should appear either above or below this video to see our programs and schedule a free initial consultation. We'll set you up with one of our admissions experts to answer any questions you might have and get you started on your preparations. We have programs to suit any of your needs, including secondary essay review, and we're always happy to work with you to determine which plan is going to support you and your goals most effectively. As ever, thank you so very much for your time. Take good care, and I'll see you next time.